I want to talk now about the coronavirus pandemic, which has grown to more than 25 million cases here in the United States. Now, the fight against the COVID-19 pandemic has been continuing as we hear more and more worrying news about new virus strains, as the president has introduced a travel ban hoping to combat these new virus variants. We're joined now by Dr. Cedric Dark, assistant professor at Baylor College of Medicine and board member with Doctors for America. So, doctor, I want to start with these new variants that we I keep hearing about. We hear that, the vaccine works on them, that the testing is still, we're still identifying COVID cases even among these new variants. I am, however, wondering at what point we need to start getting alarmed, about this new and repeated news that we keep hearing about new strains in South Africa, here in the United States, in the UK.
Well, I think most people in the public health community have a mild level of alarm anytime you hear any of these new mutations happening or new variants. They are worrisome, but the good news right now is that the vaccines that we currently have do seem to still be effective. For some of them, I believe the Moderna one, there was reports that it is not as effective as it is for the original virus, but still has some neutralizing antibody function. So the important thing is that the public should still feel fairly confident that the vaccines will work, and we need to worry about getting everyone vaccinated. My bigger concern is less about variants and more about equity as we talk about distributing the vaccine across the country. And even when we look at disparities in terms of racial or ethnic groups, we've seen that there are sometimes fourfold differences in let's say Black patients versus white patients getting vaccinated. And even among people that are healthcare workers, the people that are first in line, we're finding that once you even account for that, there are still huge disparities where the white population is getting vaccinated much more easily than the Black population, even amongst healthcare workers. And the question is this something related to vaccine hesitancy, or is it something more sinister, such as systematic issues that are putting up barriers for people that need to be vaccinated?
Well, I would love to throw that question back at you, doctor. What do you think is the cause? Because everyone has been pretty united, at least in saying, hey, we need to have as many people vaccinated as quickly as we possibly can. Of course, starting with some of those populations that you already mentioned, because we already know that some of these inequities exist. So why is it when everyone is so laser focused on this target of vaccinating as many people as quickly as possible with an emphasis on senior citizens, with an emphasis on Black and brown communities, why then are we still seeing these disparities?
Well, I think one of the major things that we have to talk about is outreach and outreach to communities. So, for instance, one of the places where I work, if you're a healthcare worker, you're, of course, first in line to get vaccinated. But then after that, we're having vaccine hubs in our cities here in Texas surrounding these hospitals. And some of that is spreading via word of mouth. And so if there are many more people that are related to folks that are already advantaged in terms of receiving vaccine, maybe they're notifying more people around their immediate circles and they're getting vaccinated to the negative impact on communities of color. And so that's one thing that we need to look at. We need to really consider strongly how we're going to increase outreach to areas of the population, whether it's the Latino population, Black population, the Native population, in order to get those communities vaccinated with real importance.
We have seen in what has been somewhat good news, case counts declining. But we've seen that happen before. One doctor mentioning to me, yeah, we do see them declining and then they go right back up again. This has happened so many times. I'm wondering if you think we're due in for another spike as you see it, given that we have pandemic fatigue, given that we have these new variants, these new mutations of the virus, which some folks are saying are more virulent, are more contagious. I'm wondering if you think this downward trend can actually hold, or if you think that with February and with March coming up, then unfortunately it's going to go right back up.
Yeah, my call to the American public is we have to remain diligent with this. This virus is still out there. Even after you get vaccinated, you still need to be out there wearing a mask, and we need to be cautious amongst those people that claim that once vaccinated, we can return to life as normal. That is not true. We need to continue to be vigilant. As you said, case counts have gone up and down, and it often changes based on things that are happening in society. Whether it was Memorial Day in Hawaii, things like July 4th weekend, the holidays most recently, being responsible for some of the recent spikes in growth in cases. One of the biggest things that concerns me is that I live in Texas right now. We are a state of 29 million people. That represents like 1/3 of 1% of the world population. Yet in Texas, we have over 2% of the world's cases. We are failing at this miserably in terms of controlling this disease. We have a disproportionate number of deaths here just in Texas relative to how the rest of the world is doing. And same thing for the United States. The United States represents about 1/4 of the cases across the world. We don't have 1/4 of the world's population. We're doing something terribly wrong, and we need to get better at it. And we need the participation and the help of the American people in order to do that.
The viewers at home couldn't see me, but while you were reading off those stats, I made a huge yikes face to how badly Texas is doing. So then I know what you're saying about wearing masks. And then, of course, I think about things that state and federally officials can do. So we have two pieces I would love for you to address. President Biden enacting a travel ban, targeted travel ban, to prevent folks from coming in from certain countries, or at least ones that have visited certain countries. I'm wondering how affected very specific travel bans like that are, considering that folks move all around the world all the time. And two, when you hear news about California, for example, lifting its stay-at-home orders, which seemed fast to me, but I'm not a doctor or a public health official. What do you make of some of these moves that have been going on? Or are you yay or nay for them?
Let me try to address the California stay-at-home order. I think that's something that is going to have to be determined locally by, mayors, maybe county officials, if not governors, in figuring out what's best for those individual states in terms of within their state. The problem is in the United States, you can travel to wherever else in the country you want to, essentially. And so that's where things like a federal travel ban into the country comes into play. And it's not just places like South Africa, where one of the newer variants was identified, but it's also in the UK still, Ireland, Europe, Brazil. It was something that the Trump administration had begun, and in the last days of the administration, they decided to get rid of it. Luckily, Joe Biden has decided to continue the travel bans that are in place. I think that's very important. And an example of this, if we look at what happened in Hawaii, Hawaii is an island state, right? They have the ability to isolate themselves from the rest of the United States, from the continental U.S. And they did so to great effect by having their stay-at-home orders and by preventing people from coming to Hawaii from outside of their state. And they were able to flatten their curve pretty well until, July and August, when, holidays hit, people went back out and, their case numbers went up. It slowly came back down. But it wasn't until October 15th when Hawaii reopened for tourism. And after that, we've seen a steady increase in the numbers in Hawaii going up since that time, not only among people that are traveling to Hawaii, but also people contracting disease related to travel, even if they are locals there. And so it's one of the cautionary tales, I would say, even as the Biden administration implements things like mandatory testing for all people flying into the United States, is that we still have to recognize that this could be a problem going forward if we open our borders too easily to people doing tourist travel.
Right. Isolation does work. You don't need to look much farther than Australia and New Zealand to see how effective it can be. Dr. Cedric Dark from Baylor College of Medicine and Doctors for America, thanks for joining us today.
Thank you.